Welcome to LASIK Details, all about refractive surgeries. On this YouTube channel, you will find everything about the different refractive eye correction surgeries. Are you considering getting a refractive, also commonly known as laser eye surgery done for vision correction? Since you landed on this YouTube channel, it is quite apparent that you are. So, you are at the right place. You will get all the details related to different types of refractive eye surgeries here. Here you will find various options that are available in terms of different procedures that are done. The pros and cons to be taken care of before you make this life-changing decision. The need and eligibility, including the age limit for the surgeries, as recommended by the medical professionals. The different pre-screening tests that are conducted to evaluate the eligibility of the surgeries and ensure no side symptoms are there. The various pre-operative tips to reassure you with respect to the surgery. And finally, the post-operative care and precautions to be taken care of. This channel is a one-stop resource with all the required information to address your queries and doubts. Before moving further on, let's go through the disclaimer. Everything on this channel is purely for informational purposes. The intent of this informational channel is to have all the relevant information pertaining to various refractive surgeries at one place. Data has been collected from various sources and individuals who got their eye corrective surgeries done. Extensive study and analysis were done to bring all information together. This information includes the different types of procedures available and what specific eye ailments these surgeries cater to, the age criteria, the operative and post-operative procedures, and the post-op care. Even though there is no dearth of information available on the internet, it is scattered, and also some sources are not that reliable. The information on these videos is to benefit the individuals who are considering the surgery. We are not a group of medical professionals or practitioners. Contact your ophthalmologist for detailed and specific information pertaining to your specific requirements. Let's begin with a brief overview. There has been a considerable increase in eye correction surgeries in the recent past. To give an analogy, like toothpaste was commonly referred to as Colgate in older days, despite many other brands being there. Similarly, people generally use LASIK for corrective eye surgeries. However, there are a lot of different methods with which the procedures are performed now. Also, the ever-changing and evolving technology has led to more advanced and sophisticated procedures, minimal post-operative complications, and negligible side effects. At a broader level, the different types of procedures are PARC or photorefractive keratectomy, LASIK or laser-assisted subepithelial keratectomy, LASIK or laser-assisted in situ keratomalosis, Epi-LASIK, Relaxed smile or refractive lenticule extraction, small incision lenticule extraction, and finally, ICL or implantable Collamer lens. We shall be talking about more details of each of these procedures, along with their advantages and disadvantages. Now, some historical background. There is a fascinating incident behind the invention of the idea to correct the vision by making changes in the cornea. A Russian boy fell from his bicycle in 1974 and his eyeglasses broke. The glass particles from the eyeglasses injured his eyes. Sviatoslav Fyodorov, an ophthalmologist, removed the glass particles, and after some time, when the corneas were healed, he realized that the boy's nearsightedness considerably improved, because the radial cuts to the cornea from the glass fragments had flattened his corneas. This led to the advent of refractive surgery techniques to correct nearsightedness that involved making multiple radial incisions extending from the pupil to the periphery of the cornea in a spiral pattern like the boundaries of a wheel, and then reshaping and flattening the cornea. To start with, let's talk about the need for refractive surgery. When it is about getting an invasive procedure done on organs like the eyes, not everyone is up for it, and rightly so. But still, refractive correction procedures are prevalent and safe these days. For some prospective patients, this could be a game changer in the manner in which they see the world. Some of the most common reasons why people opt for these surgeries are: convenience and freedom is one of the most common reasons to get the correction done. The fact that an extra pair needs to be carried while packing for a vacation, or getting up in the middle of the night to go to the washroom and groping in the dark hoping to find the spectacles in time. Who would not want that kind of freedom? People with active involvement in sports, especially swimming, generally opt for these surgeries. Wearing glasses during contact, football, cricket, etc., or non-contact sports, running, cycling, etc., may cause problems and hinder with playing the game properly. Using contact lenses while playing sports is also not recommended, as that may cause harmful complications due to sweating. In many countries, one is required to have a 6/6 vision in order to join the armed forces or the police academy. There may be some other typical courses that require the candidates to have a 6/6 vision. Youngsters opt for surgeries in order to achieve their aim of admission into such courses. Another reason why people prefer getting the procedure done is that it is a relatively inexpensive procedure, especially if one considers the cost of spectacles and contact lenses that they have to incur during their lifetimes. Finally, the fact that the procedure is quite simple and doesn't require the patient to get admitted is another reason why these surgeries are so common. Now, some bonus reasons. The ease of being able to wear sunglasses. This is something that the ones with refractive errors can highly relate to. Freedom from foggy eyeglasses during sudden temperature changes. Despite being an invasive surgery that makes changes to a very delicate organ like the eye, refractive eye surgeries are still very common and prevalent. One of the reasons this has been made possible is the advancement of technology, which has led to the safety and precision with which these surgeries are done. Coming up next is the right time to get the surgery done, and the non-exhaustive list of pre-tests that could be performed by your ophthalmologist to assess the various parameters of the eyes and accordingly check eligibility for refractive surgery. Please subscribe to the channel so that you do not miss the important information that will get periodically uploaded here. If you like the information, please click on the like button so that these videos reach out to many more people who are exploring to get their vision corrected.